After 60, one small mistake with magnesium can quietly weaken your muscles, disturb your nerves, disrupt your sleep, and strain your heart all at the same time. Many seniors wake up in the middle of the night with painful leg cramps and assume it's just part of aging. Others struggle to fall back asleep, feeling tense, restless, or oddly anxious for no clear reason. Some notice their heart racing slightly, their hands trembling, or their balance feeling less steady than before. These symptoms often appear separately, so people never connect them to a single cause. Here's the surprising truth. Magnesium plays a role in every one of these problems. And here's the real shock. Many of the people experiencing them are already taking magnesium. They take it every day, sometimes for years, yet nothing really improves. The problem is not magnesium itself. The problem is that most people take magnesium the wrong way after 60. After working with older adults for many years, I've seen this mistake repeated again and again. Magnesium deficiency is one of the most common and least recognized issues in senior health. There are 6 major mistakes people make with magnesium, and nearly everyone makes at least one of them. The number one mistake is the most dangerous, because it affects your nervous system, your heart rhythm, and your risk of falling. The good news is, this is not permanent damage. When magnesium is used correctly, it can support calmer nerves, stronger muscles, deeper sleep, and safer movement. Today, I'm going to explain why standard magnesium advice often fails after 60. More importantly, I'll show you how to use magnesium in a way that actually works with your aging body. Before we go any further, let me ask you something. Where are you watching from? How old are you this year? And how long have you been taking magnesium? Now that you understand why magnesium advice often fails after 60, let's break down the most common mistakes step by step, starting with one many seniors dismiss as just part of aging. Mistake 6. Assuming muscle cramps are just aging, not a magnesium deficiency. Many seniors believe muscle cramps are simply an unavoidable part of aging, especially when they happen at night or after light activity. In reality, frequent cramping is often a clear signal that muscles are struggling to relax properly. Magnesium is essential for muscle relaxation, helping muscles release after contraction. When magnesium levels drop, muscles stay partially tightened, making sudden cramps more likely. After 60, magnesium absorption from food declines, even when diets appear balanced. Medications commonly used by seniors, especially diuretics, quietly deplete magnesium reserves over time. This creates a slow, hidden deficiency that builds for years without obvious warning signs. Nighttime leg cramps are especially common because magnesium also supports nervous system calm during sleep. Without enough magnesium, nerve signals to muscles become erratic and overly excitable. This can cause sudden, painful contractions that wake seniors abruptly from sleep. Many people stretch, rub, or walk off cramps without asking why they keep returning. Over time, repeated cramps can reduce confidence in walking, especially when getting out of bed at night. This increases fall risk during one of the most dangerous times for seniors. Because cramps are common, they are often dismissed by both patients and caregivers. But common does not mean normal or harmless. Persistent cramping reflects ongoing stress on muscles and nerves. Left unaddressed, this stress contributes to fatigue, stiffness, and reduced mobility. Correcting magnesium deficiency often reduces cramping frequency and intensity within weeks. Many seniors are surprised how much calmer their muscles feel once levels are restored. The real mistake is accepting muscle cramps as fate instead of recognizing them as a correctable magnesium warning sign. Mistake 5. Taking the wrong form of magnesium. Many seniors assume all magnesium supplements work the same, but after 60, the form you choose makes a dramatic difference in results. The most common and cheapest form is magnesium oxide, which is poorly absorbed by the aging digestive system. In older adults, magnesium oxide often passes through the intestines, without delivering meaningful benefits to muscles or nerves. This leads many seniors to believe magnesium doesn't work for them. In reality, the problem is not the mineral, but the form being used. Some forms of magnesium are primarily laxatives rather than effective nutritional support. This is why diarrhea and stomach discomfort are common complaints with certain magnesium products. After 60, digestive sensitivity increases, making poorly absorbed forms even more problematic. Better absorbed forms, such as magnesium citrate, glycinate, and malate, behave very differently in the body. Magnesium glycinate is often better tolerated and supports muscle relaxation and nervous system calm. Magnesium citrate absorbs more efficiently, but may still cause loose stools in sensitive individuals. Magnesium threonate is unique because it crosses into the brain more effectively, supporting cognitive and nerve health. Choosing the wrong form can mean you are supplementing daily without addressing your actual symptoms. This creates frustration and unnecessary trial and error for seniors seeking relief. Different symptoms require different magnesium forms, especially after 60. Muscle cramps, sleep problems, anxiety, and nerve issues do not all respond to the same type. Using a one-size-fits-all approach ignores how specialized magnesium's roles truly are. Healthcare labels rarely explain these differences clearly. As a result, many seniors unknowingly choose the least effective option. The mistake is assuming dosage matters more than form, when absorption and function are what truly determine magnesium's benefits. Mistake 4. Taking magnesium at the wrong time of day. Many seniors focus on how much magnesium they take, but rarely consider when they take it, which becomes far more important after 60. Magnesium directly affects the nervous system, influencing relaxation, muscle tone, and stress hormone activity. When taken at the wrong time, magnesium may fail to deliver its most valuable benefits. Some seniors take magnesium early in the morning, hoping it will boost energy or prevent cramps later. Instead, they may feel sluggish, unfocused, or unusually tired during the day. This happens because magnesium promotes calm and reduces nervous system excitability. Taken too early, it can dampen alertness when the body needs to be active. At night, however, magnesium supports muscle relaxation and helps quiet an overactive nervous system. This timing aligns with the body's natural shift toward rest and recovery. For many seniors, nighttime magnesium improves sleep depth and reduces nighttime muscle cramps. Taking magnesium late in the evening can also lower nighttime cortisol levels. Lower cortisol supports deeper sleep and better overnight muscle recovery. When magnesium timing is wrong, seniors may continue experiencing insomnia despite supplementation. They may also notice persistent tension, restless legs, or frequent waking during the night. This leads to frustration and the belief that magnesium doesn't help sleep. In reality, the body simply isn't receiving magnesium when it needs it most. Certain forms of magnesium are especially calming and better suited for evening use. Others may be more appropriate earlier in the day, depending on symptoms. Ignoring timing turns a potentially powerful tool into a weak or inconsistent one. The mistake is treating magnesium like a neutral vitamin instead of a mineral that actively regulates daily biological rhythms. Mistake 3. Using the same magnesium dose year after year without reassessment. Many seniors assume that once they find a magnesium dose that seems acceptable, it should remain the same forever. After 60, the body's needs change continuously due to aging kidneys, shifting muscle mass, and slower metabolic regulation. A dose that felt fine 5 years ago may no longer match what your body can safely process today. Magnesium is filtered through the kidneys, which naturally become less efficient with age. When kidney function changes, magnesium clearance changes as well. Too little magnesium leaves muscles tense and nerves overexcited. Too much magnesium can cause weakness, low blood pressure, and excessive fatigue. These symptoms are often misattributed to aging rather than an outdated supplement routine. Medications commonly prescribed after 60 further complicate magnesium balance in the body. Blood pressure drugs, heart medications, and diuretics all interact with magnesium handling. Ignoring these interactions can turn a helpful supplement into a hidden stressor. Some seniors increase their dose when symptoms persist, assuming more must be better. This approach can backfire, especially when absorption and excretion are already compromised. Magnesium needs should be adjusted gradually as health status, medications, and activity levels change. Seasonal changes also affect magnesium needs through hydration and physical activity differences. What works in summer may not feel the same in winter. Regular reassessment allows magnesium to support muscles and nerves without overwhelming the system. This does not require constant testing, just periodic review and awareness. Listening to new symptoms provides valuable feedback about magnesium balance. The mistake is treating magnesium dosing as fixed when the aging body is constantly changing. Mistake 2. Ignoring how common medications quietly deplete magnesium. Many seniors take magnesium faithfully yet remain deficient because medications are silently draining magnesium faster than it can be replaced. After 60, prescriptions become more common, and several widely used drugs interfere directly with magnesium balance. Diuretics, often prescribed for blood pressure or swelling, increase magnesium loss through the kidneys every single day. Acid-reducing medications lower stomach acidity, reducing magnesium absorption from both food and supplements. Certain heart rhythm and blood pressure drugs also alter how cells retain magnesium. Over time, this creates a slow depletion that supplements may not fully correct without adjustments. Seniors may increase magnesium doses without realizing the medication is still pulling levels down. This explains why cramps, fatigue, or sleep issues persist despite consistent supplementation. Because magnesium loss happens quietly, there are rarely early warning signs. Symptoms appear gradually and are often blamed on age or disease progression. Doctors may focus on managing the primary condition without addressing mineral depletion as a side effect. This leaves the nervous system and muscles under constant stress. Low magnesium from medication use increases the risk of arrhythmias, weakness, and balance problems. It can also worsen anxiety and sleep disruption, compounding overall health decline. Many seniors are never told that their medications affect magnesium at all. As a result, supplementation strategies remain incomplete and ineffective. Addressing this issue may require timing changes, different magnesium forms, or coordinated care. In some cases, adjusting diet or dosing around medications improves retention significantly. The goal is not to stop necessary medications, but to support the body intelligently alongside them. The mistake is treating magnesium deficiency without considering the powerful influence of everyday medications after 60. Mistake 1. Treating magnesium like a simple supplement instead of a nervous system regulator. This is the most dangerous mistake because magnesium is not just a mineral, it is a primary regulator of your nervous system. After 60, the nervous system becomes more sensitive to stress, inflammation, and chemical imbalances. Magnesium plays a critical role in calming nerve signaling and preventing overexcitation. When magnesium is low, the nervous system stays stuck in a constant alert state. This can show up as anxiety, restlessness, shallow sleep, and an inability to fully relax. Many seniors describe feeling tense all the time without knowing why. Magnesium also helps regulate heart rhythm by stabilizing electrical signals in heart muscle cells. Without enough magnesium, the heart may beat irregularly or feel fluttery and uncomfortable. This creates fear, which further activates the nervous system in a harmful cycle. Magnesium is essential for activating GABA, the brain's primary calming neurotransmitter. When GABA activity is low, stress hormones remain elevated longer than they should. This leads to poor sleep, slower recovery, and increased fall risk due to fatigue and poor coordination. Treating magnesium like a basic vitamin ignores its powerful influence on brain-body communication. Many seniors take it inconsistently or without intention, expecting mild benefits at best. In reality, magnesium requires proper form, timing, and dosing to support nervous system balance. Ignoring this turns magnesium into an afterthought instead of a foundation. Over time, unchecked nervous system stress accelerates muscle weakness and balance decline. This directly affects independence and confidence in daily movement. When magnesium is used correctly, many seniors notice calmer nerves, steadier heart rhythm, and better sleep. The real mistake is underestimating magnesium's role as a master regulator of stability and safety after 60. Conclusion: magnesium was never the problem. Misunderstanding how the aging body uses it has always been the real issue. After 60, magnesium affects far more than muscles. It influences nerves, sleep, heart rhythm, balance, and emotional stability. Taking magnesium correctly is not about taking more pills or hoping for quick fixes. It is about choosing the right form, the right timing, and the right approach for your changing biology. When magnesium is used properly, muscles relax more easily and nighttime cramps become less frequent. Sleep deepens, and the nervous system finally gets the signal that it is safe to rest. Heart rhythm becomes steadier, and that constant sense of inner tension often begins to fade. These changes matter because calm nerves and strong muscles are essential for staying independent. Falls do not usually happen because of one big mistake, but because small systems quietly fall out of balance. Magnesium helps bring those systems back into harmony when it is used with intention. If you have struggled despite taking magnesium for years, this was not your fault. Most seniors were never taught how differently the body handles magnesium after 60. Knowledge gives you back control where fear and confusion once lived. And control restores confidence in daily movement and decision-making. If this video helped you understand something new, it may help someone you care about as well. Please consider sharing it with a friend or family member over 60. I'd love to hear from you in the comments. Where are you watching from? And how old are you this year? If you want more clear, practical guidance for senior health, be sure to subscribe to this channel. Together, we can protect calm nerves, strong muscles, and independence for the years ahead. Growing older doesn't mean growing weaker. It means learning how to care for your body wisely, so you can keep living life on your own terms.